Thank you, Mario, and welcome to our first Health and Wellbeing Board of the new administration. A little bit of introduction. Obviously, it's a hybrid meeting where the majority of officer and members are joining us online. Because we have to have a certain number in attendance for a formal meeting, while we'll be conducting the meeting as if it's formal and going through the agenda, it's only an advisory informal meeting because we aren't actually quorate, but obviously there's an important agenda that we have before us, and I think we're all agreed that it's right for the meeting to continue. Your colleagues will be familiar that there used to be a television set in front of me in the council chamber. That's now been removed, so I'm juggling between the virtual meeting grid that I'm seeing on the laptop in front of me and obviously looking into the camera and the people in the room. So it just might be a little bit slower to see virtual hands and juggle that with physical hands. But as we're familiar with hybrid meetings, please do come through the chair, keep the chat to minimum and come through the chair. Stay muted unless you're speaking, but you can unmute yourself when when I call you. And as I say, please use the chat function for the IT, any IT issues that might arise. Is there anything else you wanted to add, sort of, Peter? No? Okay. I think, Councillor Williams, you're asking if you add to the quorum if you come into the chamber. I think it's because we need someone from the health system in the chamber that's what makes the difference, I'm afraid. But thank you very much for the kind offer, and really do appreciate it. In the council chamber, we have myself, Councillor Jana Thomas, and various council officers, but there are some apologies for absence I don't think are either in the physical council chamber or online. But if I get this wrong and people have decided to join us online, then please do shout. So we don't have Stephanie Coughlin, we don't have Laura Sharp, although I think I just saw Laura maybe. No, I didn't. So we don't have Laura Sharp. Marcus Barnett, the BCU commander, isn't here, but he's got Sean Beasley, acting Detective Chief Inspector, substituting, hopefully. Dr. Sandra Husbands is not able to join us, but Ellen Schwartz should be, and there's other members of the public health team. Are there any other apologies for absence? If something comes to you, please do put it in the chat and Peter will see it. We've got various guests that are presenting. So welcome to Lloyd French from Health Watch. Marion Faruga was going to join us for that item, but I don't think he's now attending. We've got David Kingsley, Young People Rep. We've got Sally Bevan from Health Watch, John Hitchin and Beth Stout from Renacci, Andrew Monk from the Council, Merle Ferguson, Anna Garner from CCG, and Diana Benjamin, who I've seen on the call. So with Roy McCallum for the final item 11. That's the intros. Do we have any additional declarations of interest for the meeting? For formal members, I think, mainly. Not seeing anyone? Great. Thank you. So item 3 is the minutes of the previous meeting. I'm hoping people have read them. There's also the actions tracker, of course, as well, which we've introduced. So it's worth bearing in mind that even if something's not in the minute, it may have been picked up as an action. Any questions, or are we happy to approve the minutes?
Yeah, approve. Yep.
Yeah, I should have said, Mark, you were in the chair and I wasn't here, so it's a bit tricky.
No, I'm happy to approve.
Great stuff. So we'll approve those, although probably they'll have to roll forward to the next formal meeting, technically. So we're advising the next meeting to approve them. The action tracker. So within that, and thank you to Donna and the team and everyone for keeping an eye on the action tracker with Peter. We've got the next steps on the housing and health work, which is in action, and there's a narrative there that will be coming back perhaps through the Health and Wellbeing Board. We've got community engagement plan. We have Health Watch here, and I know there's been quite a lot happening with Health Watch. John, do you have any sort of comments on that about the community engagement plan? Thought I saw John a minute ago from Health
I think
Watch.
Lloyd and Catherine are here from Health Watch.
Okay. Does anyone else from Health Watch want to? No. Okay, we'll just take that as the note. And then there's the Connect Hackney Phase 2 work. And there's a bit of a narrative here and an impact. I think when I did the, sorry, I should have said that housing's not provided an update yet. John has left Health Watch. So that the impact report is in the agenda pack under item 4. So I suppose my big concern with the Connect Hackney work has always been making sure that we formally did come back through the action note to the presentation that we had, I think, 2 or 3 meetings ago. And I know we've got a bit of a narrative here in terms of what's sort of happening next. But my big request really of the entire Health and Wellbeing Board and the partnership is just not losing sight that we had them come and present. As a Health and Wellbeing Board, we accepted their recommendations and report. It was quite a challenge to the system. I think we've got the voice around working with older people in various parts of our work and reducing isolation, obviously in the health and wellbeing strategy. But I think if we do not keep an eye on this and keep sight on it, we risk losing that emphasis, and that isn't just on the council, that's on the whole system. And so that I'm pleased that we've sort of got that more sort of that update, but I think it's, as the place-based system matures, as we think about what our priorities are as an administration and how we deliver the action plan under the health and wellbeing strategy, is just keeping an eye on this really important work and the insight that it gave us. Does anyone else want to add to that? Sorry, that was clunkier than it should have been. No?
I was just going to say, it's Mark here. Just wanted to, I absolutely agree with you. And in that action recommendations, you can see how different strands of work need to be picked up at different places, and 1 or 2 need to be further sort of fleshed out. But I just think that when I was chairing last time, I was very keen that this should come back as sort of a semi-substantive item under the minutes and the action tracker. So I really welcome this. And as you say, just making sure that it's our responsibility to make sure we keep an eye on all those different strands of work and where they sit in the system. I see Nina's just popped her hand up as well.
Yeah, Nina.
Yeah, I think just a bit of reassurance to say that the connections have been made. So there was quite a few recommendations that pertained to kind of health services, and also had quite a big overlap with the neighbourhoods programme. Just to give reassurance that we've made those connections between what was Soraya, but Sonia's team, who've kind of this report and feeding that back into the neighbourhoods programme. So those linkages are happening, and I think there's already quite a lot of crossover in terms of what the neighbourhoods team were already doing and what is in this report. So I think we can provide a fuller update around a number of those areas at a future meeting when it's appropriate to bring this back.
So can we agree to sort of nuance that, so that we've had the bit of update here, we've had this discussion, and then there's general agreement, and through you, Nina, just bringing together that update as the 2 pieces of work kind of evolve. Is there a way though of sort of keeping that? I know that group was brought together by the Connect Hackney work, but I'm also really conscious they're not sort of here. As much as I'm sure they love watching the Health and Wellbeing Board on YouTube again and again and again, they may not watch us and see this debate. So just making sure through, I guess, HCVS, so there's a route back through so that they know we haven't forgotten them. And I see Susan nodding, if that's okay. Do you want to come in, Susan?
No, that's absolutely fine. I'll take it back to them.
Thank you. Well, many people on the call won't get stopped in the street about it, but I do. So that's why it's very close to my heart, because some of the older people that have worked on the project. Brilliant. Thanks, Donna. That's so helpful what you put in the chat. I'll just read it out for people that are watching at home, that they've got the update as far as we've taken it today. But so that's really helpful. Annie.
Thank you. I just wanted to say, I think there's some crossover as well to all different age groups. That point about commissioning, where we're commissioning, having increased social connections as a default outcome. I think it often happens, and sometimes it's explicit, but sometimes it's not quite there. So we commission quite a lot of activities for young people through the holiday activity and food fund, and just making sure, I feel I need to make sure that increased social connection is part of that. And I think there are probably other commissioning activities that go on as well. So I think it's just worth spreading beyond just the older age group people.
Yeah. Thank you. Well, that's really useful, a really detailed update here. And I think a general sense that we'll keep an eye on this as a Health and Wellbeing Board in the context of neighbourhoods and the strategy. So that's great. I'm really pleased that we're able to do that. Is there anything else on that or the actions? No. So we're happy to note the action tracker, and we're rolling them on. So item 5 is question from the public. I think, as I hinted at the start, the residents not able to attend the meeting now. So Donna, the question is related to physical activity and health budgets.
Yeah, that's right.
Do you just want to explain how we just handle the admin in the background?
Yeah, that's fine. So the question and the answer is in your agenda packs under item 5. And for anybody who hasn't been to the board before, this is a standard item where we invite members of the public to ask questions to the Health and Wellbeing Board. So for this meeting, we had a question submitted from a resident around physical activity, and the question was about opportunities to be active in Hackney and why there isn't direct investment for older people, like a health package to help them remain healthy. And we've collated a response to that question, and we'll make sure that it's sent to the resident who has unfortunately not been able to attend today. But we've outlined within the response the offers that we have in Hackney that are either free or very discounted, and that's offers that we commission via public health, as well as LBH's core offer to older folk as well in the borough. So that's through our leisure centres, but also through walking programmes and new age games as well, and our free swimming offer. So all of the detail is in the paper. And also we wanted to reassure the resident that physical activity is really important to Hackney's Health and Wellbeing Board and organisations that sit on that. And it's definitely an action that we're looking at in terms of some of our strategies at the minute. So the new manifesto includes a commitment to invest in a network of new free outdoor gym facilities in parks and green spaces. The council also have an ageing well strategy that physical activity elements are part of. So there's a lot of work being taking place around that in terms of place-based support and funding for over 50s as well. And it's also, physical activity is also outlined as a potential action in our health and wellbeing strategy around our 3 priorities too. So that action plan is obviously going to be developed up in the upcoming months as well. And then in terms of the actual question about prescribing physical activity, although we don't have, we've spoken to NHS colleagues about this, and although there's not a budget per se for physical activity, this is definitely a conversation that's happening across the borough, across loads of organisations, including the NHS, social prescribers, health and wellbeing coaches, LBH staff, the voluntary sector are encouraging and promoting residents to be active and outlining different ways that they can do that, how they can build it into their day through active travel, and also outlining the programs of work that we have that are free and discounted. So there's a lot of work going on in this space. So I guess the response was to reassure the resident around those key elements of work. And that's all.
Thanks, Donna. And clearly quite a lot of overlap with the Connect Hackney update, and it's in a similar territory, isn't it? And I hope there's a lot there to reassure. And I know that we sort of worked on bringing in the local NHS voice into the response. I think it would be fair to say there's probably mixed kind of practice out there a little bit, that some places are really flying. I've met people where GP conversations have led to sort of gym engagement and other activities. So it's crucial, isn't it, that we continue to, through our neighbourhoods work, that the work around social prescribers and community connectors is obviously really important to this agenda. Raj, would you like to come in?
Hi, everybody. So got a query regarding, I'm just looking at the document that you put on the agenda regarding the 67-year-old. What about those individuals who are under 50 years old? This morning at my pharmacy, I had a person that I used to be able to help as part of a weight management service, and that service was decommissioned by the NHS. I'm just trying to think, is there anything else that's around? Because I don't know if things have changed or moved in the last few years, but in terms of signposting them, referring them into the service, helping them lose that weight, they've come back deliberately to me because I helped them a few years ago, but I put the weight back on. I don't know if there's anything out there for people, probably on benefits as well. So again, struggling with that, specifically around losing weight.
Yeah, there's definitely
Just
local
just a second, Donna. So
Sorry.
So the question for people that may not have heard it is, what is available for people that are under 50 and that I think had been previously involved in a weight management service that was maybe delivered in partnership with community pharmacy?
Yep. It was commissioned through NHS, not locally through the local authority. But I think I know better the leisure centre were delivering weight management service. I'm not quite sure where we are with that, as that's still ongoing or not, and how do we signpost them into that, or how do we refer them into it from the community pharmacy settings?
Yeah, so back to Donna.
Yeah, that service definitely still exists, Raj. So we've got face-to-face offer, and there's also an NHS offer of a digital weight management program as well. So there's lots on offer for people to help manage their weight, and there's universal cook and eat classes as well if people aren't eligible for that criteria for the weight management. And we've also got physical activity on referral too. I'm happy to link in with you and other members.
That'd be great.
To make sure that information is sent across.
Okay.
Okay.
Thank you, Donna. Thank you. Thanks.
Okay.
Thank you.
Thanks, Donna. And I guess for people watching at home, the Here to Help area of the council's website has quite a lot around locally based food projects, and many of them do have a weight management, but as well as full food poverty kind of focus. But if we can get that over to Raj, that would be great. Maybe just put into the minute as well, so that it closes down that item. Thanks, everyone, and I hope nothing untoward has happened to the resident, and that they're all okay, and that they do get the response. Moving on to item 6, which is the Joint Strategic Needs Assessment update. Deanna, I think you're leading on this item. It provides an update on the JSNA work plan for 21-22. There's not a huge amount of time given we've got a packed agenda. So the promise is this is a brief update to for the board to check that they know this work is on track. If you've got anything that you want to follow up with Deanna, please put it in the chat. So a slight break to protocol. And then the deeper commitment that it will come back more substantially in September. But do you just want to very briefly introduce, Deanna, where we're at?
Yes, just thank you, Chair. And like you said, really quickly. So the update is about the current work program. In your document packs, you can see that there's also an update for what we've done last year. Obviously, we could not do business as usual due to the COVID pandemic. So the program work was very, very much reduced. But nevertheless, we managed to complete 3 large needs assessments, and that not to 25, oral health, and early identification of domestic abuse. All 3 were to inform commissioning of services. And we also completed the annual Directors of Public Health report, which you can find in the link, and it will also be presented later today. All of this information is on our JSNA website, and just a quick tutorial. This is the website itself. You have the link. It has all of the key information about the needs assessment process itself, all the recent publications, some news and updates, as well as some social media feeds from both City and Hackney. And we've added some of the infographic and interactive profiles, which you might find useful as well. So for this year's, I have encouraged all the stakeholders to submit the topics to me at the beginning of the financial year, and they have done so. So we've got quite a packed work plan this year, and you can see we already have a number of topics, including alcohol, sexual health, tobacco, cancer, homelessness, whole system obesity, substance misuse, and cardiovascular disease. You can see the purpose with which we are going to be doing those and the proposed start date. So a few of them already has started and are in progress. In addition to these, we also have research projects that will be informing needs assessments and other work like policy and strategy. And these includes the sexual health survey, which we have a really good response rate to. We have over 2,500 responses to our local sexual health survey, which is amazing. And we also have a booster for survey of Londoners. We're going to be analysing those, especially given that some of our health and wellbeing strategy priorities are around social cohesion and financial hardship. Survey for Londoners provides really good information around those topics. COVID reinfection analysis to support some of our ongoing and future public health protection work, and the census that's going to be released. Some of the first data is going to be released at the end of this month already. And that's it.
Thank you, Deanna. And really excited to have a face-to-face conversation with you last week about the updates that you've been doing to the web portal. And so colleagues that may have been familiar with that site and the information, it's had a Deanna zhuzh up, I think, since taking some of the lessons from COVID, and you're continuing to want to work on that and iterate a more public-facing, more interactive and more useful set of data. So, and that work's obviously underway. I'm really pleased with what you said about the sexual health engagement and the responses. I think we did a lot of promotion around that, and it's really good to see that people have engaged with those services. I know I said I wasn't going to start a debate, but the question in the chat from Nina is probably the only question I would have had, is just how it sort of links and empowers the work around the Health and Wellbeing Board sort of strategy.
So some of them will be directly linked to the health and wellbeing strategy, but mostly they are in line with the other work. So if there is a commissioning coming up and it needs to be informed by taking the stock of the most recent data and reviewing the evidence, then we will do a needs assessment on that topic. And you can see from what I submitted for today's board meeting that most of the topics are to inform commissioning, and only a few to inform strategy. So yeah, so it depends on other work areas and what's the most pertinent at the moment. But like I said, the survey for Londoners will provide really good insight into those two topics that are covered by health and wellbeing strategy. And I'm sure there will be ongoing mental health work. I know that Population Health have been doing some good research around IAPT uptake and inequity in the service uptake.
Great, that's hugely helpful. Any other points? I think the easiest thing, Deanna, is maybe people should have your contact details, but putting that in the chat for any follow-up or anything else that people want to discuss outside of the meeting. I don't know if Councillor Kennedy knows, or when the sort of sexual health recommissioning work kind of reaches a closer to decision point, and do we get a sort of update here? I know we've had previous updates. No problem.
I was just saying that the NEL wide fertility services consultation is now open. It runs into July. You can go on the NEL website. That's just on a related topic, Chair. Thank you.
Frances, you're on mute, sorry.
Just a quick question to Diana about how she's linking in with the voluntary sector in needs assessments.
I have met with Hackney Health Watch, and they are aware of the work programme. I'm yet to meet with City of London Health Watch, and I also suggested coming to some of the bigger meetings where there is a bigger forum of different organisations when they come together. So just waiting for an invite. But it is a very good question, and I did reiterate to Hackney Health Watch when I was talking to them how crucial their role is to that evidence base, because we don't always have a scope and capacity to, say, do an outreach work or do qualitative research, and they could potentially be our partners that could help us with that.
Okay. So just bear in mind that it's not just Health Watch, there are a whole range of organisations out there.
Yeah. So working my way through them.
One of the things, and I'll bring in Susan from HCVS in a second, it may be the same point, but we did agree strategically with HCVS to support a sort of borough evidence base that would assist with funding applications and commissioning. So, you know, a lot of the voluntary sector organisations are able to obviously access external funding, and this is clearly one of those sets of data that would maybe assist with preparing kind of applications and projects, but also, you know, measuring impact and supporting lobbying sounds too trite, but just, you know, sharing that evidence base. So I don't know if that's the sort of territory you were moving off into, Susan, if you just want to comment, but it probably is a good idea that obviously it's open data in the sense that it's available through the portal, but I guess building that relationship is really important as well for asking both the obvious questions and the deep dive. Susan. Sorry, you're on mute, Susan. It may be, you're not on mute, but it may be a factor of how your mic is configured. I'm really sorry. I can't hear you in the chamber, even if you, can you hear online? No. sorry. The one ruse that does work is logging in by phone and using the phone as the mic while keeping the video in as you are. That might work. But if you want to put the point in chat, I think that would be really useful. And obviously, you've got Deanna's email address, and please feel free to copy in Donna if you just want it sort of recorded. But I'm sorry that hasn't worked at this stage of the meeting. I'm going to move on though, because we inevitably, because I'm chairing, we've started to run behind. So item 7 is the Community Voice Anchor Institutions Research, Young People's Reflections and Recommendations. There's clearly 2 items around Anchor, so they are very much linked, but we're going with the Community Voice element first, as we always do at the Health and Wellbeing Board. And I've got Sally Bevan from Health Watch and David Kingsley from the Children, City and Hackney Young People's representative. So you're going to present, I think, for 7 to 8 minutes, and then there's 5 minutes for questions. I'm not going to second guess the rest of the points and just hand directly over to you guys. I think David's in the room, and is Sally online?
Oh, I'm
sorry,
here.
you're both here. Sorry. So David and Sally, over to you. Your mics may clash a bit, but let's see how we go.
Share it.
Hello everyone, I'm Sally from Health Watch. I'm the Engagement and Co-Production Manager, which is a system role hosted by Health Watch Hackney, and I'm here today with David, who is our lead young public representative for City and Hackney. David's going to present a set of slides. Is it possible for the slides to be shared?
I probably do that.
Sorry, we're still adjusting to being here in person rather than online. It's a bit new to us.
I only have access to the for slide. Someone emailed. I can use them, or they're in the public agenda pack. Bear with me. But, there they are. 1 second. Can we all see? Right.
Perfect. Thank you very much.
Very happy to facilitate. Sorry, that took slightly more painful than it should have done.
Oh, that's wonderful. Thank you. So I'm going to hand over to David now.
Thank you, everyone. Hi, everyone. I'm David. I'm here to represent the Hackney Integrated Care Partnership, and our report is about anchor institutions in the Hackney area and their relationship with local young people. So, firstly, a little background on who we are. The Young Public Reps are a subgroup of the City and Hackney public representatives, aged between 19 and 29 years old. We currently have 12 members, 5 female and 7 male, and are made up of 66% Black or Black mixed heritage people, 25% white British people, and 8% white Turkish. Our work feeds into the City and Hackney Integrated Care Partnership by representing the patient and resident and public voice. We're able to do so by running engagement sessions and focus groups and carrying out peer research. We use the engagement sessions and focus groups. We use the information collated from this to inform and influence decision makers. Can you just move to the next slide, please? So our focus has recently been on anchor institutions. Anchor institutions are large organizations that are firmly rooted in an area, and this is unlikely to change, such as hospitals or local authorities. Such organizations have great social and financial impacts as they are in a position to influence and benefit the local community and are able to offer employment to its members. Specifically, we've been asking young people how they perceive these institutions and their ideas on how the organizations could better serve local communities. We used an open survey as a basis for discussion to discover the thoughts of 36 young people in Hackney relating to the topic, with the aim of presenting recommendations derived from their responses. These people were found from our own personal connections and local networks, focus groups within London Borough of Hackney, but within the London Borough of Hackney Young Futures Group, Young Futures Commission Group, and the Young Public Reps Group. Next slide, please. So having spoken to the young people in the Hackney area about these institutions, the responses demonstrated a collective feeling that there is a lack of communication with young people from the organisations. Any present engagement was largely only known to people already participating in volunteer work. For example, one responder's comment, "Until I joined the Healthwatch programme, I wasn't aware of any engagement with the local community, if I'm honest." When asked how the community could be better served by these institutions, there were many great suggestions. In particular, there was an abundance of comments from participants highlighting a desire for workplace opportunities, as this provides financial security and career options. However, they felt that they were little available. Upon our own investigation, it was discovered that there are a number of opportunities. For instance, there are internships available at Homerton Hospital and some supported by Hackney Council. From further discussion with local young people, it seems that they are not taking up these opportunities for two main reasons. The lack of engagement on the part of the institutions means that they are simply unaware, that many are simply unaware of their existence. Those who are aware and are reluctant to apply because of a lack of trust stemming from personal negative experiences with the service and or the association they have with the government. It was concluded that this is it was concluded that this is what is most needed. It was concluded that what is most needed is honest and improved communication, positive interactions with the service, and encouragement to get involved from existing staff, as this will improve trust and awareness of workplace opportunities. Let's go to the next slide, please. This theme of engagement to encourage young people into the workforce and find ways for this to be more easily accessible is a crucial topic. It is consistent with the priorities identified by other healthcare-related organisations. It links to the Hackney Health and Wellbeing strategy priority of greater financial wellbeing, to North East London integrated care systems prioritization of getting people into the workforce, and to Healthwatch Hackney's draft 3-year strategy focusing on the way in which we are working with young people. Just go over to the next slide, please. Given the importance of the theme and the overwhelming desire from our responders, we've collated their suggestions and come up with a list of recommendations on how anchor institutions in Hackney could better serve the young people in our community and provide workplace opportunities. Engagement could be improved and opportunities provided by providing newsletters about the service to give an honest view of the organisation, to build trust, and informational videos to let people know about the workplace roles available to them. Partnering with small organisations and charities to use their greater financial advantage to put on events and provide volunteer placements. The connection to smaller organisations can help with raising awareness as they are more trusted, so it should increase interest levels. Also collaborating and combining their financial assets to run pop-up hubs involving all anchor institutions to put on events like group walks, provide support such as discounted healthy food and activities, raise awareness of opportunities, and generally foster a sense of community. Institutions could set minimum requirements for the number of local people that they employ to ensure that they do not lose out on opportunities. They could be required to offer training and opportunities to upskill these people to allow them to move into a paid role. The importance of frontline and local staff being visible and connected to local young people has been noted as crucial for engagement, as this can allow for positive interactions and learning from people that they can relate to. This could be done by organisations creating a youth outreach campaign involving these staff, and Healthwatch could facilitate peer training and events, for example. Finally, with the support of the Health and Wellbeing Board, a group of local young people could take on responsibility for collating existing opportunities and co-producing a communications and engagement campaign to raise awareness of these opportunities. Named leads from the Integrated Care Partnership organisations could work in collaboration with the young people to achieve this. The public reps and Healthwatch Hackney could lead on recruitment and oversight of this project. There's been a suggestion that the final recommendation could be taken forward as a system influencers project, or that there is funding available to take the recommendation forward in more depth. Sally will give you a little bit more about this in a moment.
I'll just quickly jump jump in there to talk about that last recommendation. There was a really strong feeling from the young people that this was a snapshot. We've had a look at what's out there, and the feeling that, do you know what, young people don't really know what's out there. There are some opportunities, but how are they being communicated, and what are the gaps? It was hard to tell. One suggestion was to take forward a much more in-depth piece of work. We've got a programme called the System Influencers that's just starting to run through children and young people's projects. It would involve two of our young people spending 4 or 5 months working really in depth to look into more about what is the offer, what are the opportunities, what's missing, and how can we really create a comms and engagement plan to let young people know what's out there. What's particularly nice about the System Influencer programme is it's a mentor programme. So if the Health and Wellbeing Board felt this would be a great thing to take forwards, we would be looking for two members of the Health and Wellbeing Board to act as mentors to the young people for that project. So a huge time commitment, but it's a really, really nice way to kind of support young people as they progress and move towards the workplace themselves. So I wanted to put that out there, that that might be a really good way of taking this paper that the young reps have done forward in more depth. So I'll pass back to David, and thank you very much for listening. We're open for questions and comments.
Did you want to? Sorry,
Yes,
you're passing back to David.
Yeah,
sorry.
sorry. Councillor Susanna, do you have a question?
So,
Or is that
just
directed
through the chair. Just 1 second. I'm just checking. There's no virtual hands. So, Councillor John Thomas.
Thanks, Chair. Thanks, David, and to Sally for this paper. It's quite good. But just want to pick one of your recommendations that came out in your presentation around communication. And we know when young people see, in particular with services and organizations, they don't feel they're getting that communication. And when you are talking about communication with young people, it's different from people like us. I'm the one in my family, they told me nobody use Facebook anymore. So something like that. I know you said honest newsletters. So again, can you see what I meant?
Yeah.
The honest newsletter and informational videos. And I'm wondering, in your research and talking to young people, what forum are they looking into, medium to broadcast those videos, or the honest newsletter? Would that be a direct newsletter to individual, to organizations? What are they thinking? That would be useful if you can say something around that. And the second, or the other recommendation that I want to pick is around the front line, connecting to frontline staff and local young people. Again, probably you can tell us more about what the expectation of that and the possible outcome if they think, if that is happening, what would they be expecting to happen around that? Thanks, David.
Before you come back, I've just got Deputy Mayor Bramble. If you can hold those questions, so I just think if we take your points and then one response, then we won't get into a long debate because we don't have time for that, sadly. Deputy Mayor Bramble.
Thank you, Chair, and thank you for the presentation. I'm just reflecting on those recommendations and thinking of the work that we do as Cabinet members and the Mayor, Councillor Regina Thomas, when we meet around young people, and thinking about a way that we can take those recommendations with the young people that we work with, whether it's through our Hackney Youth Parliament, Hackney Young Futures, and think about how we shape and work on some of those together. That was just more a suggestion, and if you think that would be a good idea, because I know there's forums that we use to engage in young people, and I'd really want to hear from them how we could better engage more young people around the messaging that we put forward and to get them involved in this important piece of work. Thank you.
Thanks. I'm afraid that's triggered some other hands. So Andrew Monk online, and then Stephen Haynes in the room.
Thank you, Mayor. Just so really useful to see a report and hear about some of the concerns. Really happy to have a discussion offline, principally about how the Employment Skills Service can better engage and communicate. working in partnership with voluntary sector organisations, some of the opportunities we have, you know, as you mentioned, a number of opportunities with health organisations and other businesses. And it was actually a conversation which the Mayor and I and Councillor Williams had with another voluntary sector organisation this morning. So yeah, happy to take that as an action, Donna.
Thanks. There's 2 more hands went up. That's all the hands I'm taking. Stephen doesn't want to come in anymore. Thank you, Andrew. Catherine, Pelly, Councillor Williams, and then back to David and Sally.
Thank you. I'm really interested in this because actually the fact that the young people feel there aren't the opportunities, I think it's really quite sad, because actually if I look at our organisation, our policies are driven, you know, we've got work experience policies that are targeted for the children and young people of City and Hackney, and you know there is the office, so it's just trying to make sure that we think about how we make that connection, because there is an opportunity that we can provide around volunteering, becoming a member, work experience. We reach out to schools, so just trying to understand what the disconnect is and what do we need to do differently to make sure that people are clear, and also how do we use it as I think it was referenced our frontline staff, but also people who can be quite influential in that cohort of staff to connect into their communities and young people themselves, because they may well be parents of some of the young people who want an experience. So maybe outside of here, think about how we can better publicise what is on offer from the Homerton.
Catherine, Councillor Williams.
Yeah, thank you for presenting, making the presentation of this. As Andrew was saying, just this morning, we were hearing from a host of institutions and organisations and employers about what we can do and what they can do better to get the word out there. I think that's a challenge to us as well. You know, we were focused this morning on other employers, but this afternoon, we've got to focus on ourselves. And it's always easy, I guess, for us to think that we're doing everything we can. But as Councillor Fitzgerald Thomas was hinting that, bits of communicating with young people and who we work with as mediums for that message is really important. We do have to keep shifting that over time. Volunteering is something that's really going to be quite key. But however, that said, it's key for the landscape of employment and developing skills. But my hope really is that we can put young people into jobs that pay a good wage, a good salary, and that has career progression opportunities and paid training as well. But volunteering will be an important part of our landscape going forward.
Thanks, Councillor Williams. So we had an ask in front of us around whether members of the Health and Wellbeing Board were willing to act as direct mentors for the young people, as I understood it. And then there's a how do we take the findings back into the system to improve the response. So I might sum up the actions again in a sec, but I know there were some questions and just comments. I think David and Sally should have a sort of right to reply on that, and then I might try and steer us to actually respond to the big ask they made of us.
Yeah, absolutely. So we're going to have a go and make sure, hopefully we won't miss any of the points that were raised. So if I'll make a start, David, and if you want to jump in. So trying to take it in order. I think the thing that came up when we spoke about the newsletter, it wasn't so much about the format of the newsletter, it was the honesty. I think what the guys felt when we spoke to them was that often the newsletter presents best foot forward. Isn't everything great? And what they were saying is, wouldn't it be nice to have a newsletter that said, you know what, this hasn't happened, but this is why we're struggling with staff and we want to be there with you. That kind of honesty would help to build trust. So that was something that came out quite clearly. On the topic of, I'm with you, I thought Facebook was the way to go, but I was told the same. And also around kind of going out and talking to people in person. I spoke to some of the young guys with you the other day, David, didn't I? And I said, if I came up to you as a group and I started talking to you and I wanted to get engaged with you, how would I go about it? What would I say? And they told me you wouldn't. If we didn't know you, we wouldn't speak to you. Middle-aged white would go away. Very nicely, they said it. But if someone that looks like David came up to us, yeah, we probably would. So there was that came through very strongly as well. Before I move down the point, so David, do you want to jump back in on that idea social media wise or other channels? How do we reach young people?
I think it's just a thing of like, when we're looking at campaigns, look at the different kind of social medias that young people are using at the moment, and how to kind of target them through kind of like advertisements, but also at the same time, like Sally mentioned, meeting them where they are. So in youth-based places, in schools and whatnot, if you get people like positive representation, if you get people that look like myself and other young people who reflect the borough, they are more likely to engage. What I found as well, I've only been in the borough for about 2 years and been on a few of the kind of engagement co-productions for young people. What I found is you tend to get a specific type of young people. We always use this terminology of hard to reach for the others that don't engage. They're not hard to reach, we're just not engaging them properly. It's just a thing of we need to look at different approaches. You may have young people, for example, who are involved, who are part of the youth offending team and may want a career option or a change around, and they won't engage it because, for example, they may not be aware of what's out there. They may have a lack of confidence of themselves to apply as well. So it's multi-layered. It's not just a case of they're not aware. Some are aware, but don't have the confidence to be able to kind of push themselves forward, or don't have that faith in themselves that, you know, even if I apply, I won't get it, or they won't like me because of the way I speak or something like that. And it's like, that's not the case at all. Like, but again, we need to be there obviously for the young people to encourage that. But yeah, back to Sally.
Thank you, David. And following down the points, you spoke about the different groups, and I really like that idea of if you've got the young public representatives, you've got young futures, you've got youth council. Would there be a way of bringing 1 or 2 representatives from each of those groups and looking at other groups that are out there together, whether it's once a month, bi-monthly? So let's share what is your group doing, let's pool our experiences. I think that would be something that would be really, I'd be very keen to look into that from our
Youth consortium of sorts. Yeah.
Yes, yeah, like exactly that. I think that would be fantastic. Following on down the points, it was about the Homerton. It really struck me when we were doing this engagement work. Young people told me about other hospitals in North East London that offered the same opportunities that we then, when we looked into it, we realised that Homerton offers these amazing opportunities. So there's something which, I mean, potentially if we take this work forward, maybe we could work closely with Homerton to unblock that communication, because we realised there's some great stuff going on. But when we did that initial going out, talking to people with surveys and interviews, no one knew it was there, and that feels like a shame. So it'd be good to figure that one out. And I think the other point that I've missed, when young people talk about frontline staff, what we talked about was you have kind of day-to-day encounters with doctors, receptionists, with someone on the desk at the council when you go in to pay your rent. Lots of those day-to-day encounters, if they look almost like, it's a bit like that, they're making every contact count type approach, really. If there's young people and they would say, do you know what? I love my job. Would you be interested in doing something like this? Just wanted to let you know while you're here, there's opportunities, and just almost feeling quite joyful and say, do you know what? Working with the council is fantastic. Working with the NHS is great. Just wanted to let you know there's opportunities. Have a think about it. That kind of casual contact was something that quite a big, especially actually some of the much younger, the teenage people that we spoke to were saying, do you know what? Wouldn't that be nice to realise? This feels like a nice place to work. It feels like a happy place to work. Yeah, I'll take that away and think about it. So I don't know if there's anything kind of in a recommendation that would fit with, but that was the sense that we were given.
I know there's probably more you'd want to say back to some of the other colleagues. I'm really conscious of time. There's 10 recommendations outside of the presentation. And then obviously the points that were enunciated sort of with more power from Sally and David. I think we probably need some sort of coordinated response to the 10 recommendations across the system, as we did with Connect Hackney as an action. Otherwise they get lost and it just becomes about the mentoring offer. I don't think I'm going to ask for a show of hands in the meeting, but if perhaps Donna, you with Peter could share David and Sally's contact details, and we try and get a commitment for a group of people perhaps from across the system that would be willing to engage around the mentoring bit around the young people. I think it has to be a bit of a balance, because it sounds like it's a health and a council piece. And then I think there's two actions that we need to do. One is to convene, as I think hinted at by Deputy Mayor Bramble and Councillor Jana Thomas, the three most relevant groups. But HCVS may well have their own young people that they'd want in the room as well. I'm thinking, accounts bring to mind, but it's probably a wider group than that. Yourselves, Young Futures and Youth Parliament. The other thing about Youth Parliament is that they have some questions and sort of concerns in this area, as well as health policy as well. I know this is predominantly about anchor institutions and skills and employment, but obviously I'm sure there's wider discussions about mental health and well-being and being heard, and do these institutions serve young people. And then the final thing I'd like to add as a fourth action is to just pick up what Andrew's put in the chat. When we did the work around COVID, around what messages work for young people about the vaccine, the Brea in the council convened some co-production around messaging around COVID, which then went London-wide. It does seem that while we do have a really good set of communication tools for our employment offer, they're not landing with some people. And I think rather than second guessing that, can we bring together yourselves and Andrew's team with comms, I think is the offer in the chat, perhaps Councillor William, and just exploring where we're missing the mark and not the assumption about how we're doing it, because that co-production really did work around some of that sort of messaging. Would people be happy with those as the four actions? So response to recommendations, convening, the mentoring and the comms. Is that okay? Good,
yeah.
Fantastic.
Yeah. Thanks.
Great stuff. Look, I've just sent off lots of work for everyone, but you know that's what happens when I'm in the chair. Mark will resume slightly, not doing that in the future. Now, some of the answers and some of the response around anchor institutions and their role might well come from the next item. So please do stay, David and Sally, and I will hand over to Donna, John and Beth, looking at health in all policies and the Learning from City and Hackney Anchor Collaborative.
Thanks, Mayor Glanville. I'm quickly just going to introduce the concept, although David's done a brilliant job, so he's done all my work for me. So I won't really speak for too long, and then I'm going to hand over to John and Beth, who will tell you about their learnings over the last 3 years. I'm going to attempt to share my screen, so just tell me. Oh gosh. Is that gone? Can you see that?
Yeah.
No? Yeah. All good? Okay, great. So yeah, as David already more eloquently than me described anchor institutions, I won't go into too much detail, but just so that we're all starting from the same point. In terms of what we mean by an anchor organisation, it is typically, but not exclusively, not-for-profit organisations that are based in a place and unlikely to move location, usually because of their purpose, and their mission is intrinsically bound in that place. They're often one of the major players in the local economy and can use that power to and improve opportunities for the people in that place. In terms of areas of impact for anchor institutions, they can really influence a wide number of factors, including the local social, economic and environmental conditions, and they can really play a role in helping us reduce local inequalities. And this image on the right shows the areas that are often a focus for anchor institutions, and the areas of impact that they can have. So thinking about the environment and in terms of our sustainability actions, and the economic side of things in terms of upskilling our residents and our local population and providing employment opportunities and making sure, as Councillor Williams was saying earlier, that those opportunities are good employment opportunities, and the quality is of a high level. And then I think the intersection in the middle is around health and wellbeing impacts for our local residents, how we use our land and our estates, and the opportunities that exist within our procurement processes as well. I think one thing that's not mentioned in that image that's really important to include as well is the impact that anchor institutions can have on the social conditions for people as well, and how they use their spaces and how that can benefit the community too. So lots of positive ways that anchor institutions can impact local residents' opportunities and improve the health of individuals and communities. In terms of the policy context, I just thought it was important to point this out before John and Beth take over. Progressing anchor institutions work is a national priority, so the NHS long-term plan and the NHS People Plan both outline ambitions to create new opportunities for people in more deprived areas to enter employment within the sector. And doing that through expanding apprenticeships, providing routes into employment for volunteers, and working closely with other anchor institutions such as schools, colleges and universities. There's lots of change in the health and care system at the minute, so it's a good time to be having this conversation as we develop the work around ICSs, and they're also thinking about place-based partnerships. So a real opportunity here for NHS organisations, local authorities, the VCS and other local organisations to work together to really benefit local residents. And then if we think about zooming out a little bit from City and Hackney, NHs have a health and care partnership, and that focuses, an NHS health and care partnership, and that focuses on widening access to employment, training and a better work experience, procurement for social value, maximising the social value of their buildings and their land, and supporting a greener and healthier future. And if we come back into the sort of local strategic principles as well, we're doing well, a lot of you on this call will already know that anchor institutions and anchor collaboration is mentioned in our new health and wellbeing strategy for Hackney as a real key way to address inequalities locally. And the new Labour manifesto also has a commitment to develop a Hackney net zero partnership as well. So bringing all the local partners together to think about how we can work together to reach a net zero borough. So that's some of the policy context around anchor institutions. And I'm now going to hand over to John and Beth, I believe, to talk us through the learning from their programme.
Thank you. Thank you, Donna, and thank you, Maya. So hello, everybody. I've presented to groups a little bit like this one a couple of times in the past year or so. So for those of you who have seen some version of this before, apologies. But there's a couple of things that I just want to kind of talk through, and then also to push on into some new things that will hopefully be supportive of the next conversation. So we, Nhs, are a Hackney-based social enterprise, and we're interested in the concept of collaboration around anchors based on a lot of the work that we've done elsewhere in our work, particularly some of the work we've done with other funders and in other places. And it really builds on that really great presentation and description that David and Sally gave around some of the questions that they were raising. We've been doing this for about 3 years now, and a lot of the reason why it's been going on for so long is because of obvious COVID reasons. And what we wanted to do at this point was kind of have a serious check to see what we learned and what would be useful to think about in terms of, as Don has alluded to, there's a real opportunity now for the system to think about what it wants to do next with the changes to NHS and other partners, and so how do we put what we've learned into that. If we just go to the next slide, please. I just want to stress here that the collaborative nature is what I'm going to be talking about. We've always tried to, in what we've been doing, and I'll talk about what we've been doing, not get into too much about what the individual anchors are doing. They've got their own strategies, their own work, their own priorities and governance. What we've been interested in is what happens when you bring them together. And to the next slide's point, what our motivation was, how can you get greater impact than if the organisations did this work on their own? So to some of the things that David and Sally were talking about, how could you use collaboration as a tool to further some of the challenges that work was kind of raising, would be an interesting question. What would happen if Homerton and other partners did something collaboratively across the system, is the sorts of questions that we were interested in, because we know there's an enormous amount being done by the individual anchors in the borough already. So who have we engaged over the last few years? I won't do the tedious reading out of this slide, but the range of partners who are here in terms of council, it was the CCG when we started, and a range of others, and we started from Renee kicked this off, and so started from very much an exploratory point of view. We didn't want to push it too far. We didn't have kind of authority, I suppose, to kind of jump too much into these agendas or these issues. We wanted to kind of test this with partners, see what people were interested in, and do it in a bit of kind of bottom-up way from the institutions and what they were interested in working together on. That led to, if we just jump to the next slide. I'm going to skip this one because Donna and David have already covered that one. And I will skip this one too, if that's all right, because I might come back to it. So that led to particularly 2 areas of work. Again, I won't read all of the detail in here, but particularly to Donna's Donna's Venn diagram, to the areas around workforce and around procurement were things that were particularly of interest to the colleagues that we were talking to. And we tried to make some progress in those streams around things that partners could do together, around workforce, particularly interested in shared apprenticeships and system-wide apprenticeships from a number of partners, and that was building on work that was already being done. And then procurement, and we had an ongoing kind of workshop with procurement colleagues across the system, exploring a lot of it has been ways of sharing information, understanding practice across the system, and there's been some ideas for further practical work. And so what we've by taking the approach we've taken, and that sort of a learning approach for those officers and colleagues within the anchor institutions, is how can, if we come together and talk about shared challenges and issues across the system, how could we do something together? I'm going to come back to some of the challenges of that in a second. So if we just move on a little bit further, that's led to a range of, so if we just pick procurement in particular, there's been kind of a range of opportunities that come out of that. Some of these were things that were already happening around how could different institutions collectively engage suppliers, how could institutions collectively develop common social value metrics, how could we think about practice on the circular economy across the whole system. And these were things that had real important interest for the individual anchors, but coming together allowed them to think about how we could all be more than the sum of our parts, I suppose. What that has led to, because I'm in the interest of time, I'm not going to go into all the detail, but very happy to take questions, is some very positive things. But I think what I want to do in terms of talking about what we've learned is some of the things that haven't gone so well. So positive things, we've got collaboration within the group, there's been debate, there's been challenge, there's been practical sharing of resources. But what we've struggled with, and this is perhaps, we definitely take this and we've learned from this ourselves, from the way in which we've gone about trying to encourage and enable this with colleagues, is found it hard to get an alignment in timescales, processes, engagement from senior decision makers, and limited commitment to really collaborating on resources, because we've started from the sort of conversations between, rather than at a meeting such as this, where agendas can be set, and that can allow for, actually, we do want to do something serious on youth employment opportunities in the borough, to pick on David's previous item, or whatever it might be, and then that flows down to the organisations that are, and the colleagues that are working on some of these agendas. So how would we use procurement to tackle that? How would we use our employment or apprenticeship approaches to tackle that? And so whilst there's been some really good things, we think that we could have done more by exploring more some of these practical opportunities, but we also, with hindsight, wished we could have come to groups like this earlier to say, okay, here are some opportunities. What are your priorities? And so that's a number of, and that what we've called on. If we just skip a couple of slides ahead now, Donna, because I've talked through some of those. On this slide, we've talked a little bit about that kind of authorising environment, and a group like this, which, a cross-system governance group like this is the sort of thing that can kind of create that authorising environment. So that it could have also it can also set shared goals, and it clearly would embed it much more transparently into local governance systems, which we haven't done to date. You know, we've done it from a sort of bottom up. Could we pull some partners together? And so I've got a slide which I will finish on, which is some of the recommendations. I don't want to talk through all of these because I think that the following conversation is more important. But I think what I would say that we've learned is that we think there is huge potential value for this. Particularly hearing the previous item, I think there are a number of things that in individual institutions that we've worked with and the system as a whole could really benefit from taking collaborative approaches and building ways for officers and colleagues at senior kind of back office, operational and frontline levels to think about how they work together meaningfully on some of the problems that have been identified. But if that is what the system wants, then what we have learned is that the role that we've taken needs to be more practical than we've been. We needed to have forced more practice, and I think that's something that we've learned. We've kind of allowed it to be a bit too theoretical at times. We needed to have got earlier into this authorising space that I mentioned to make sure that it fits with local system priorities and local kind of governance and other things, so that kind of authorising from a range of partners and individuals and institutions can be made real, and that we have shared and agreed kind of priorities and, for want of better language, indicators or KPIs for those priorities to make sure that we're holding ourselves and each other to account, that we are doing something, that we are seeing change on, for example, youth employment in the borough. I'm going to just keep using that as the example. Because the way in which we've gone about it to date has been a little bit too bottom up. Where are the interest? What's going on already? How could we collaborate? And that is good, but I don't think it has maximised the opportunity of these sorts of approaches. So what we wanted to do with the paper that's in the pack and this presentation is to say, we think there's potential here. We've learned a lot. We think that there's a lot more that could be done. But there are some things that if you are, as a system, going to press on with it, you need to make sure that you've got in place. Otherwise, you might miss the opportunities of this sort of collaborative approach. I'm going to stop there in the interest of both time and
thanks, John.
If for others. Thank you.
Thanks. So Stephen, I think, wanted to maybe just come in for a minute and talk about our anchor works. I'm going to do something really radical to the agenda. I think the next item and the real substantive discussion about this is impossible to do in this hybrid meeting with time available and the people in the room. It does both this report and the debate that I'm supposed to lead a disservice. It also does a disservice to the agenda items that are still waiting to be discussed. But Stephen, do you just want to come in? Because the challenge for me is I've got the recommendations in front of us that allegedly I want us to all sign up to. And in the next item, I've got questions for you about how this relates to our health and wellbeing strategy, the 10 cross-cutting areas, and 5 questions you're all supposed to answer or help answer. And we have no post-it or online boards. So I just don't think we can do it. Anyway, Stephen, do you just want to just touch on sort of what we've been up?
Thanks, Mayor Glanville. And just for the benefit of David and Sally and any partners that I haven't met, I'm Stephen Haynes, Strategic Director of Economy, Regeneration and New Homes at the Council, and also a member of the Health and Wellbeing Board here. So I'm just going to talk very briefly about the Council's recent history with this, and I'm going to keep it quite simple because John has covered many of the issues already. So I just want to make a few points. Everyone thinks there's huge amounts of willing. We realise this is the way to solve big problems, but we've struggled in terms of accountability, in terms of structures, in terms of governance, which sounds quite boring, but it's actually really, really important. What happens is, and John again talked about the work around procurement and apprenticeships, which Andrew and his team who come under me have been working diligently on. Huge amounts of motivation there, huge amounts of appetite to get things moving. But it reaches a point where things stop because there isn't that structure in place to hold people to account, to agree what the targets are. And that's because other organisational priorities take hold, and that's completely understandable because we are big institutions, big organisations with big things to worry about. But I'm increasingly of the view that for the things that I'm responsible for in the council, be it delivering new homes, employment skills, adult learning, place shaping, regeneration, we can only make real progress if we're working closely with our public sector partners and the voluntary and community sector on defined areas of work. And that's an important point because we have to be very clear about what it is that we focus down on. So my sort of plea, I suppose, as someone who's been involved with this with John and others, is that we agree that there needs to be an accountability structure within the system here that we all sort of adhere to, that there's the most senior level buy-in, which means chief executive level buy-in, and that we move to a place where we stop talking about the theory and try and get on with the practice of it. So, sorry, Mayor, that's probably not what you thought I was going to say. You thought I was going to talk about some of the work we've done, but I think it's hugely important that we take this opportunity, because I got really frustrated at the end of last year, and I spoke to Sandra and John and Jane and Donna, and I said, well, look, what is the structure that can move this forward? And we thought that the Health and Wellbeing Board was a really great place to start. It's how we then take that forward in a slightly different way. But I guess, yeah, you've heard my plea. So, but very conscious, Mayor, of what you're saying about how we can give this justice and do it justice. And my sense is that there's a wider session here that we need to do quite quickly somewhere. But that's just a sort of thought. Sorry, I went on too long there, but that's my sort of two-penned work.
Yeah, and I think it fits with what I just said, and I've seen Ellen's hand. And I also think it looks like we're only having a discussion amongst the anchors as well. So I'm conscious of Rosemary, I'm conscious of the VCS organisations, the challenge we've just had. And I suppose what we're showing you all is we still haven't even cracked the bit where we collaborate to then go out with you and test, are we in the right page and how could we work with you? And that's why I think this is quite a difficult discussion to have in this forum. Because if I'd read those slides, no offence to John, I would be like, I don't see myself reflected in that if I'm from either small organisations, HCVS, what Susan's put in the chat, and the rest. I want to bring in Ellen, and then your point about chief exec buy-in. I do think we have to take these recommendations and the questions and try and get buy-in for an event and a discussion, and also collectively decide, are we doing it under the sponsorship of the Health and Wellbeing Board because it's the best place? The actual anchors are here, the second and third biggest employers in the borough on this call. Or are we going to do it in the Community Strategy Partnership Forum or a new forum or what have you? Because I think that's also part of the challenge. We went here because Elft and Barts and some people were really committed. I do want to just praise the Homerton. They've just got nearly 4 million or over £4 million worth of public sector decarbonisation funding, which I think is fantastic and really noteworthy on the net zero side of the presentation. But, we have to make some choices here about where we deploy our resource and our discussion and where we have it. Ellen.
Yeah, thank you so much, Matt. So I didn't want to derail your attempt to kind of limit this, but I feel I just have to say 2 words because Sandra Husbands is not here, and also Jane Taylor, the consultant who's usually leading in this area. Just to go right back very briefly to Donna's first couple of slides to highlight the strength of the evidence between good employment and health, and also social cohesion, these factors, and when we're talking about health, particularly mental health. So there is a huge opportunity here to support some of the main priorities of the health and wellbeing strategy. And then also opportunities to link this in with a place-based workforce planning strategy. And a very tangible offer from Dr. Sandra Husbands to use the Health Inequality Steering Group, which of course is the other kind of weaved tangential aim that we're trying to achieve, to discuss next steps in the next meeting in July. So a very, very tangible offer. Thank you very much.
That was quite a powerful and useful offer. to maybe scope out some next steps and the response in the context of health inequalities. I do think that was quite useful. I don't want to lose John and Beth and the work that they have done and the challenge that they've provided to us. Would we be happy to note the report, skip the next discussion and say that we want to return to it in a structure, and then ask the people around us to work out what that would be and how it relates? Because there is something about the action plan as well on the health and wellbeing. You know, I've put a plea out with Mark to get nominated people from the institutions represented here to develop the action plan. So the health inequalities group and the action plan work should be happening, and they could be tasked to just assist us with this. Mark, you've got your hand up.
I'm just going to say to support the way you're approaching the summary of this, and also to say that the work, I think the inequalities group is a good place to hold it and actually to make some recommendations. I think that actually getting more substantive conversation and discussion about it will happen in more than one place. I think one of the places should be the Integrated Care Partnership Board in one of their development sessions, because it would be, this is exactly the sort of thing we should be doing in that sort of space. But I think it won't cover all the points. It won't cover all the elements of an anchor organisation that the local authorities could potentially provide. So I think it will go into more than one place to have those chunky conversations. But I think if Ellen and that offer comes back here with a sort of saying, well, here are the places where we're going to actually do this, and with an update about, as you say, the ask of senior figures to actually, you know, sponsor this work, which as John sort of alluded to in his notes, hasn't really progressed at the pace that we'd want. And as we've heard, partly is because it gets displaced on the to-do list by the kind of today's issues, and of course, you know, much of that's been affected by the pandemic. But nonetheless, you know, we're now returning to it, and we want to give it more momentum. So I think what Ellen said is a very good way forward, and we'll be able to bring it here to review what the plan is and where it goes. I feel confident that we can make sense of a really complex, challenging set of issues, but something which is so important that we do make the most of, because the potential of it is fantastic.
I agree. It's the accountability bit that I'm looking at John's face. For those that have been working on it for 2 to 3 years locally, I think it has bounced a little bit between some of those structures or their predecessors. So I do think we have to be tight and say we want to come back with a plan in September for how we'll engage, or do some of that engagement before then. Diaries are incredibly tight. We're co-producing quite a lot at the council and within the NHS, and we've got the obviously the ICS forming. We've got a new leader of the system in place with the chief executive of Homerton Care. They also have influence, but I do think where John's presentation started, you know, long-term plan, NHS London, everyone has signed up to the anchor principles and the impact, as Ellen has suggested, that good work plays in good health. So we should be able to do it, even if we haven't cracked it yet. So I'm going to basically ask Donna to try and, with Peter, take recommend what we've discussed here into a concrete action that we can then share. I'm really sorry if people were expecting that wider debate, but we simply don't have the time for it, and we would never have done it justice, I don't think, anyway, in retrospect. So that effectively means we note that and the action. Is there anything, Donna, from the next steps that you would just want some clarity on? But as I say, we aren't going to be able to go through those key bullets, because I think we need to move on to the health inequalities toolkit.
Yeah, that's no worries. That's clear to me in terms of the next steps with this. Thanks, Mayor Glanville.
Great, thank you. And is there a way, is in the health inequalities group, is the VCS representation? There is. So we won't exclude by, because that would be the other bit, is if we just all wander off again and then come back with a plan, that would be unhelpful. So Agreed? In a non-agreement meeting? Good, excellent. Right, we're almost back on track. Thank you everyone's patience. So we've got Anna Garner presenting on, well, presenting around the Health Inequalities Toolkit, but looking at the role of the Health and Wellbeing Board in tackling inequalities.
Thank you, Mayor. So hi everybody, I'm Anna Garner. I am Head of Performance and Population Health at the CCG. I'm going to talk to you a bit about the background of this project and where we got to it, and then talk you through kind of potential options of how you might use this project and offer of support as a Health and Wellbeing Board. So I'm just going to try and share my slides. Okay, I'm hoping that you can see that. So I will come back to those potential options in a second. I'm just going to give you a bit of context about it. So this was identified by discussed as part of the previous item, Health Inequalities Steering Group. They had a mapping process where they went through and identified priority areas that would support us tackling health inequalities better across City and Hackney. And they identified the need to make sure that different levels of the City and Hackney system knew what tools and resources, etc., were available to support different, again, levels of the City and Hackney organisation, of the City and Hackney system. So by that we mean individuals, teams, services, organisations, and the system as a whole, including system groups such as this. And to use those tools really to embed the idea that inequalities are everybody's business, and to make it easier for people to have, to consider that really strongly all the way through planning and delivering work. So it was identified by the Health Inequalities Steering Group. The City and Hackney Population Health Hub are delivering some of this work. So I'm the lead for the hub, and we're doing this in partnership with other people, including the Equalities and Diversity team at the CCG, and Angela Bartley, the Population Health Consultant at ELFT. So we said we're going to develop a resource pack that has got stuff around the context of health inequalities, so what we mean by that, what are the drivers of inequalities, and how that plays out for the residents of City and Hackney. And we then, so that was our first draft of developing the resource pack. We then wanted to pilot the pack with different pilot areas to make sure that they understood it and they felt it was relevant to them. So again, we tried to pick pilot sites from across the system and from various sectors, etc., to make sure that this was relevant to everybody. So they include, thus far, one of the North East London clinical networks, the library service of the city, with a few planning teams across the system, with primary care, and with a voluntary sector network linked to ELFT. And so, yeah, that was to finalise and make sure that the pack was relevant. So I've talked a bit about what the pack contains. So it's got a bit about context, it's got sources of information that people can access, and then it's got a set of prompts to start people thinking about how inequalities play out within their area, and what that means for them, what they know, what they don't know, and then different tools that might support further work. So far, we've started work with most of those pilot teams and kind of introduced them to the idea, and are getting through the kind of prompts and identifying actions bit. So I've included in your pack some of the kind of context stuff just for information. And we've had to kind of make these prompts quite specific for the Health and Wellbeing Board. Sorry, I haven't made it at all clear. The Hackney Health and Wellbeing Board was one of our pilot sites, in that we've said we're, as I say, trying to pilot this across a number of different levels. And we discussed and said the Hackney Health and Wellbeing Board is a good system group. Start thinking about how you as a board, with composite members, might think about how you might consider health equity with a more focus. The prompts usually are about kind of specific services or organisations. So we've had to take a slightly different approach and develop specific prompts for the Health and Wellbeing Board. And they are there. So they are either around kind of how the information comes to the Health and Wellbeing Board and how you think about that information without making the information that you get from people kind of tick boxy, where they're not kind of engaging with this as a process that is useful. There's something about that we could use these prompts in developing the actions as part of the Health and Wellbeing strategy. And let me go back to those prompts at the beginning. Yeah, there's also stuff about how you want to play out your health and all policies approach, and whether the toolkit is useful as part of that focus that you have. They're quite big questions. I'm conscious that it is 5:30 and you've already done a lot of thinking, but it was really to come and say we are developing this and we would like to work with the Health and Wellbeing Board to think about how you might better consider health equity as part of the work that you do. And I'd be interested in people's take about whether one of those options is a helpful option, or whether there are other ways that we could support the board to do its work.
Thanks, Anna. So just to keep that right to take down that last slide, but that is obviously the critical set of the question is what support would be most helpful to the Health and Wellbeing Board to better consider health inequalities in their work as a board, but also as individual partnership organisations. So it takes us a little bit back to the JSNA discussion, but also the toolkit obviously goes much more wider than that in terms of health equity, and there's a series of options that might be how we can work together and help and support individual parts of the system and organisations. Annie.
Thanks very much. Thanks, Anna, and thanks, Meg Lanville. I wanted to ask if there was anything, because that hack is quite, the questions are quite high level and could apply to any area of the country. Is there information given, which I know we have because we've done the needs assessment, that encapsulates what the key inequalities are in Hackney, so that we can make sure in our discussions, and that might apply to the previous item as well, that we are discussing the key things about our place, about the city and Hackney?
Want me to come back on that now, Mayor, or?
I'll just see if we've got any other contributions, because that was actually quite a good, tight, simple question. So, Councillor Kennedy.
I'll try and keep mine as tight. Should we be applying these questions possibly more to the delivery plan for the health and wellbeing strategy? And or should we be looking at our entire work plan, you know, our whole future, the future work that we scope out for ourselves? So sort of like it's our final item, isn't it? Looking at what we've got coming up and checking that is inequality focused as well.
Thanks. That was very tight. Thank you, Councillor Kennedy. Do you want to have a stab at that? I suppose if I was to add a question, I think it's in the slide pack, sort of slide 3 is almost like one of those classic attempts to do a sort of plan on a page, or a set of approaches on one page, and there's a lot in there. There's a bit around sort of prioritization as well. So we've got it. Is it the same as it would be for anywhere? Question from Annie, largely. Councillor Kennedy, how does it influence the action plan? And then, you know, what's the prioritization suggestion, Anna? Thanks.
So can I take them in slightly reverse order of Councillor Kennedy? I think definitely we can be applying the questions to the delivery plan for the health and wellbeing strategy, and I think that would be a really helpful way of using them. Annie, great question, and something we'd touched upon briefly. I think with the development of the health and wellbeing strategy and the development of the outcomes for the health and care integrated delivery plan, we definitely have a set of things that we have identified as these are the big adverse outcomes for Hackney, and therefore there is another option, I think, of the Health and Wellbeing Board could go through those to say we would like a response from relevant teams and partners across what we are doing on inequalities in each of those outcomes. I think that would be, yeah, and also a really helpful option for the Health and Wellbeing Board to consider. In terms of prioritisation, yes, I'm not. I hadn't planned that bit of how we get to a decision from the Health and Wellbeing Board of how we want to use this, and some of the work that, as you say on slide 3, is going ahead anyway, and those 10 broad areas came out of a prioritisation process from the Health Inequalities Steering Group, and they are purposely cross-cutting them to make them relevant across partners, organisations and services across City and Hackney. So they've kind of fed into then the prompts that we might use. So i.e. there are prompts around data, there are prompts around anti-racist and anti-discrimination approaches, there are prompts around community engagement, etc.
Thank you, Anna. I don't see any more sort of questions or comments. Is that enough? I don't feel we've completely hit the question. Is there anything more that we sort of want or need? No, we're content. Sorry, Councillor Joanna Thomas.
Thank you very much. My question is in line to Annie's question earlier on around how these tools talk to Hackney situation, and I just want to ask around that. You know, there is the tools from BMA. Is this any way different from that, or is it the same thing or that we are using? Sorry if you've mentioned that and I missed it. Thanks.
No, so I mean, we've tried to encompass all the kind of tools that we can find and try to kind of distill them down into what are the helpful prompts that would help people to consider this. And yes, they are quite general prompts. I mean, on purpose, really, of them being able to be used however we see fit. But yes, I think, I mean, if it would be helpful, I can kind of distill this into a few of the options that we've talked through today, and you can either revisit or do a kind of decision on what you think would be most helpful as a board.
That would be hugely helpful, Mark.
I'm just thinking again, just a bit more time thinking as you challenged us, Phil, because although I think these prompts are terrific, and I think we should be using them in answer to Chris's question about all work and policy, but actually the power of them will come upstream a bit. You know, rather than presenting to the board, say, have you thought about this? Have you thought about that? You know, actually in the planning early on, way before they come to present, you will be asked to make sure that you have addressed all these prompts in your planning. So, you know, make sure you do before you bring it down, you know, in 6 months' time to wherever you're going to bring it to. So I think that's the, you know, the greater power in a way, that it shapes the work as the work emerges, as it's created. And so we need to think about how we make sure that happens. But that's doable.
For sure.
Can I just ask, the final bullet about the options for work says bringing together partners to map existing activity and identify groups for identifying key actions within the health and wellbeing strategy. That feels slightly overlappy with the action plan group and the health inequalities group, but I also think there's a way of looking at population health as a lens for that work that I think that bullet is indicating. So just how does that sort of three things that slightly overlap work together, or have I missed it completely?
No, I think we'd have to work that through, how we do that and how we work on that going forward. That'd be a helpful prompt. Thank you.
Thanks. And I suppose in terms of sort of tasking of that, the thing that still interests me the most is how, if I'd love to get to a point where if we all walked out from wherever we are and went to a bus stop and someone said, "What have you just been doing?" And you said that I was at the Health and Wellbeing Board, and they said, "What did you discuss there?" How we're tackling health inequalities. And they said, "What are you going to do?" We could pass the bus stop test, that Hackney is doing this, and it's going to solve that. And it's how, and that's what I'm sort of searching for from the action plan. I think we could all talk about how, you know, we believe in reducing isolation, tackling health inequalities, how we're working together, health and social care integration, the neighbourhood model, how we work with the VCS at sort of anchor level and at grassroots level. But to what end? And I was hoping Ellen might jump in. You know, is that going to mean that in 5 years' time, Black maternal health in this borough is as good as white maternal health? Is that going to be solved? You know, fundamental things, and we've got a way of measuring that across. So that, you know, sorry to get passionate, but that's sort of what keeps me awake at night occasionally. That for all of this, we need to just get real clear sense of what our place is for. And I'm going to give Ellen the last word, and then go back to Anna, and then we'll move on to a very important topic around childcare.
Thank you very much, Matt. I couldn't help myself to jump in, because I think it's so fundamentally important. And Anna, thanks for presenting what you presented. But the whole day today was essentially about inequalities. I think, Nina, you asked Diana earlier, how do the JSNA chapters correlate with the health and wellbeing priorities? Because they identify inequalities. And it's a way of looking at everything, at policy, at strategy, at commissioning level, looking at patterns and identifying inequalities. And then, so it's when we're saying health and health policies, we can say inequality, or the equality lens looks at everything. So I think it's fundamentally important. And thank you. I hope that was helpful.
Fantastically helpful, Ellen, and the same level of passion as well, which I really appreciate. Rosemary put her hand up and she hasn't spoken yet, so I'm going to bring in Rosemary and then go back to me.
Yes, good evening to everyone, and thank you for the opportunity to have a say in these very important matters. So I really do like the analogy of if you went to the bus stop and somebody stopped you and said, "What have you been doing today?" and so on and so forth with regards to health inequality. And, you know, my thoughts around that is to do with, you know, working more collaboratively, but working towards a shift in the power structures, and how, as we do that, we can, you know, make room for growth, you know, for investment into those who are, for example, the young people, communities that are disadvantaged and marginalized and so forth. And in that respect, you know, through, you know, equitable distribution of assets, then that is another approach, if you will, that we could develop more as to how we can reduce health inequalities. So there's no silver bullet, but it's just looking at things from, you know, different angles and how we can leverage that to bring about improvements to the lives of the people that we are serving in our communities. Thank you.
Very powerfully made, Rosemary, and I really thank you for it, genuinely. Anna, did you want to say anything? Also, the critical point there is power imbalances, asset parity, power, money, voice at the table. Anna.
So we have conversations about that within the Health Inequality Steering Group, and that's so one of the 10 priority areas around community involvement, engagement and empowerment. Empowerment's a tricky word, but yes, it involves at an individual level as well as the shifting that balance of investment and power, Rosemary. So yes, absolutely, I'm with you. As you say, not easy to enact though. And yes, here absolutely the point about yeah, how will we know the impact of what we're doing, and how will we be able to change course if in 2 years we think we're not on track for the 5-year challenge you've just thrown out about parity of health outcomes for Black women. And yes, we can kind of build that all into how the role that we see the Health and Wellbeing Board in playing in holding the system to account for some of that. Should I have a go at kind of pulling together a bit of a menu of options, considering what people have said, and then we can choose how to take that forward? Is that the most useful?
I think that would be fantastic. Deanna, you put your hand up. I am trying to close the item.
Sorry about that. Just really quickly, the JSNA process, while it is a JSNA process, but it really works for any program or any policy. So there is an inbuilt accountability and impact assessment in there, and we can just use those steps as well, whatever topic we are approaching. So how do we measure? The answer is we plan in advance. So what are those measure indicators that we're going to use? So whatever we are starting, I think we need to always think about how we're going to evidence that we've made an impact with every program. And if helpful, so the JSNA process is on the website, and that could be also used maybe like as a springboard when people start thinking about how do we redesign a policy or service, or how we make it more equitable. Just that.
Again, very helpful. And I think there's a lot of alignment with how Anna finished as well. So thank you, everyone. I'll move on to child Q. We've got Diane Benjamin and Rory McCullum here. I did just want to mention that obviously the Health and Wellbeing Board takes the annual safeguarding adults report and looks at it and has done some relatively deep dives into that work, and has done similar through the history of children's safeguarding historically. This is clearly if anyone watched the scrutiny, joint scrutiny review on Monday night, the degree of passion and anger and commitment to change that I have, Deputy Mayor Bramble has, Councillor Vajana Thomas, Annie, others on the call, including Councillor Williams. So just that's why we're talking about it, because we talk about safeguarding here, and safeguarding is a critical part of the building blocks of the Health and Wellbeing Board. We haven't yet had a chance to see this sort of report. So the purpose is to a little bit of a look back at the original safeguarding report. And I know that the safeguarding panel are very willing, and already have through Rory and Jim and others, including I think HCVS, of sort of taking that report out to communities and talking it through. I think we do not have time to do that kind of exercise here, and it has been done, as I say, very powerfully in other places. But I think it is important that we do look at it, and we've got a bit of an update as well, my understanding of what we've been doing as well. So Diane, Rory, is it a bit of a double act? Diane, I think you're going to start.
Yeah, thank you, Mayor. And in the interest of time, I'm not going to go through the whole of the report, because I'd like to think everybody has read it, but I just want to take you through some of the highlights if I can, and then Rory will just go through some of the granular details in terms of timelines, etc. So this report really outlines our the Council's response in relation to Child Q. Our immediate response involves the Council establishing a gold group under the Council's critical incident management structure. This was in place from April 22. This group consisted of looking at the immediate impact on childcare and our family, looking at staff, and looking at our community. In addition, in May, we formed a strategic response group, and that met fortnightly to continue to oversee the Council's response. This was chaired by the Chief Exec and attended by the Mayor, Deputy Mayor Bramble, and Councillor Vajana Thomas, and key stakeholders engagement as well. The Council's response sits alongside the formal oversight of the review's 40 recommendations by the Independent Child Safeguarding Commission and our City and Hackney Safeguarding Children Partnership.
Council is not named in any of the 14 recommendations, and our role is to focus on ensuring that partners implement the recommendations with rigour, understand and respond to the impact of the review on staff and the community. And so I just wanted to take you through some of those highlights in terms of what we've done and our plans thus far. So we want to engage, look at the wider issues in terms of what ChildQ raised. We want to kind of work with partners to support the implementation of the recommendation. This covers working with the police, working with schools, and that public-facing campaign and how we interface with that. Working with police, having a shared action plan to restore trust and confidence. Working with schools to look to consider and revise protocols of safer schools for police officers, guidance on how police work with schools. Focus on our sustained work on anti-racism. We have a number of work streams that support positive influence over time. We've had sessions on cultural competence and diverse curriculum. School staff were invited to the Council's 4-day anti-racist practice conference in May. A further conference is scheduled in the autumn with more emphasis on early years, schools and colleges. A number of training sessions on adultification has been expanded to, and that's available to all schools. Some of the key areas for me is that sustained work on the voice of the child across the borough. We plan to build on the Young Futures and the Youth and Hackney Youth Parliament work to make sure we always hear the voices and views of children in schools and about schools. That sustained work on the voice of parents and carers across the borough. We want to build on the work that officers have done in terms of hearing their voices across the school structures. We will work with our engagement team, our counsellors and our community and the volunteer sector to foster and shape this work. Hackney Inclusion Charter. We will broaden the initial head teacher's commitment across national and cross-London work on our inclusion charter for schools, as well as the impact on the white paper, the green paper, to scope and to take this forward in terms of a Hackney inclusion offer. Schools and settings. We recognise the profound distress caused by this case and other incidences in terms of racism of our Black and global majority staff, children, community. We continue to provide peer listening sessions in terms of racialised trauma and that vicarious trauma that staff are feeling. We've got drop-ins and Q&A sessions. We want to promote anti-discriminatory practice within school governors. We want the role of school governors to shape our school strategy to also monitor impact. But I just want to finally talk about lessons learned. And when we talk about lessons learned, it's really important to note that this work hasn't started now. There's been work done in the past and up until this point, and that's included improving outcomes for young Black men. There's been work streams in children in education. As I noted to and alluded to, we've had our anti-racism practice conference. Hackney Young Futures has set up an independent commission that's been funded and accountable to the council. They've carried out extensive and wide-ranging insight, followed by a period of co-production. Unfortunately, many residents do not see what happened to ChildQ as an isolated incident. We therefore have to restore and recover trust and confidence in policing, the culture of our schools, and confidence of our children in schools. It would be really remiss of me if I didn't talk about the institutional racism that exists. And that for me needs to exist in the same paradigm as the incident in relation to ChildQ. We need to engage children, parents, staff across all our communities. We have an undertaking and several work streams to begin this work. The next phase is to work with Black girls and the impact that this particular ChildQ incident has had on them. We want to look at a thinking space, which is a theoretical approach-led space for the community. We also want to take forward the work with the community to begin to heal and restore trust and confidence. Thank you. Rory, any thoughts from you?
Thanks, Diane, and thank you, Mayor. So just 2 or 3 points to add from me. Look, I've undertaken a number of these reviews in my professional lifetime. The challenge is never really about identifying the recommendations. The challenge is about embedding the learning that comes from them. And I think when we look at the Child Q report, there's a number that link to policy guidance, you know, and those, to be honest with you, will probably take care of themselves. The big challenge here is about the thematics that are coming out of this report. The thematic about how you build a culture of safeguarding first across your professional systems. So our frontline staff and volunteers who are working with children and young people are thinking about safeguarding in everything that they're doing. And then also the issue around active anti-racist practice. And those two things aren't just creating a policy document and signing it off. That's about culture of organisations, and leadership sets the tone for those. What's been really encouraging with the Child Q, I mean, there has been a massive amount of pace and traction and response, particularly from the council in this space, but with partners equally as well. There's still lots of work to do, but it's going in the right direction. As Diane has kind of pointed out, there are various structures in place that are covering off those thematics, working closely, collaboratively with partners. But importantly, we need to land this and engage this with the children, young people and the communities that we work with day in, day out, so they come up with some of the solutions, because they're the ones who are seeing, hearing and feeling the impact of this on the ground. That's all I'd have to say. Thank you very much.
Thank you, Diane, and thank you, Rory, for adding to the published report and bringing alive what we're doing. I did just want to say, I think if you go back as well to the original report, the health system actually play a crucial role in identifying the harm and making the safeguarding referral, and that just shows, I think, that the previous work around safeguarding and support, and clearly there's in the work that Diane's talked about, and I know Deputy Mayor Bramble's keen on, in terms of public health trauma-based response for the community around some of the issues involved, there is a direct link over to the work that we do here as well. And clearly, as Diane said, there's not recommendations for the health system, but I think it does sit within the wider work that we've been doing, and obviously wanting the health system to be anti-racist as well. Did anyone else want to sort of come in on this item or ask any questions of Diane and Rory? I've got Deputy Mayor Bramble. I just want to get a sense of sort of numbers so that I think about time, because we're losing people. So, Deputy Mayor Bramble, thank you.
Thank you, Chair. It was more just to thank officers like Rory, Diane, Sonia and Jim for the work that continues to happen, and obviously Hackney Education alongside that. I just think it's important to stress that this is a safeguarding issue, and that's not my opinion, albeit just because I'm black. Actually, if you look at the findings of the report, it clearly states that there was a safeguarding issue and that was overlooked, and hence because the young person was not responding to in a safeguarding matter and they were criminalised, there was a missed opportunity all through that process. So I think that's why it's really healthy for it to sit here. And why is it healthy to sit here? Because that had an impact on that young person's health and well-being. We now have a young person that didn't access our services around mental health and well-being, who does now because of a direct experience that they experienced within a school setting. And I can't stress that enough. Hackney Council and partner agencies have worked tirelessly to move, shift, direct and demonstrate action. What I would say is that we all have an opportunity and a responsibility when we talk about time and journey to challenge that. We know racism isn't wrong. We know what it looks like. It's really important that we all are actively eradicating and challenging that. Thank you, Chair.
Deputy Mayor Bramble, and I think that really adds to the powerful words that you made on Monday evening and anchors it, as I was trying to do in this board. I think all of us as well will, I think, welcome where the IOPC is going in terms of its own investigation and moving to that heightened uplift from misconduct to gross misconduct. And I've commented on that with colleagues in the last 48 hours. Are we happy to note this item? And I suppose, thinking about our work plan, which is the next item, and some of the health and public health related work, that possibly we may not have the panel update by our November meeting, but certainly our first meeting in the new year would be able to look at the safeguarding panel's sort of update report after 6 to 9 months. Rory, would that be correct? So let's just say that we have a continued role, and this is one of those public forum places where we can put it into the public domain and discuss it, just like scrutiny. So let's use it like that and maybe take it in the new year. I know that feels a long way off, but actually it's really important. I just want to draw us attention. I know we've lost nearly everyone in the room to the next item. Thank you again, Rory and Diane, and obviously Annie's in the room as well, which is our work plan, sorry, the forward plan. We've got the 1st of September meeting fairly heavily scoped out and the 9th of November. I think in the item on Hackney Connect, we seem to suggest it might come back to September, but actually here it's in the November meeting. And I think that gives a bit more time to that work and it connects more with children, young people and older people. I did just look though at the theme and it's huge, especially if across either of September or November, we want the anchor report back. So I don't think we should do it in committee, but myself, Mark, Donna and others may just want to discuss where we go around those 2 meetings. None of it looks massively slippable, given the themes that we're sort of working towards, and I'm sure some of them have deadlines, but it's going to be a hard meeting to give those items justice and have the community voice in there as well. But on that note, thank you so much for those that are still with us, for the people that contributed and all those that presented and wrote reports. And I think I'd just draw attention to the fact that there is an AOB in the sense that the annual Director of Public Health report for City and Hackney has now been published. It's attached to the pack and it focuses on children and young people and COVID across City of London and Hackney, looking back at what happened, has some high-level recommendations for next steps, and from what I've seen is really fascinating, interesting reading more broadly about children and young people as well. I presume if people have got questions or comments or feedback, going back through either Donna or direct to the public health team and Sandra Husbands herself. On that note, I'm going to bring us to a close at 6:05. Thanks very much, everyone. Thank you.
Thank you.